Hi, this is Ashley Passmore, and this is my head-to-toe video assessment. So first I'm just going to do a 360 scan of my environment. So keep all hands and feet inside the ride at all times. All right. Ooh, it's so... Here's my willing subject. That's where we're hanging out. Okay. All right, so I have gathered my supplies, I've cleaned them. I'm going to enter the room, perform hand hygiene, provide privacy, and introduce myself. Hi, my name's Ashley. I'm going to be your student nurse today. May I have your name and date of birth, please?
Brandon Passmore, 5180.
Thank you. I'm going to check that against the wristband and also in the medical record to verify for accuracy. I'm going to be doing a head-to-toe assessment today, which is just a basic overview of your body systems to make sure everything is functioning properly. If you have any questions throughout the assessment, please let me know. Do you have any allergies that you know of?
Just seasonal.
Okay. So I'll also check that against the medical record and update if necessary. So I'm going to start with assessing the vitals. Blood pressure should be between 95 and 140 for the systolic, 60 and 90 for the diastolic. Pulse should be between 60 and 100. The rhythm should be regular, and the intensity should be 2 or 3 plus. Respiration should be 12 to 20. The rhythm should be regular. The depth should be appropriate for the situation, either too shallow or too deep. And oxygen saturation needs to be 95% to 100%. And I'm also going to assess pain on a 0 to 10 scale, 0 being no pain, 10 being the worst pain he's ever felt. Are you in any pain today?
No.
Great. Had he been in any pain, I would, in addition to the number indicating the severity, I would also assess the character, onset, location, duration, any exacerbations, or relief factors, or any radiation of the pain. Next, I'm going to assess his mental status. So because he was able to say his name and date of birth, we know he's oriented to person. Can you tell me where we are?
Mimi's house.
Mimi's house. Can you tell me what month it is?
December, November.
And can you tell me why we're here?
We're doing the head-to-toe assessment video.
Okay. So he's oriented to person, place, time, and situation. His mood is stable. His affect is congruent with mood, appropriate for the situation, calm, and cooperative. So now I'm going to be moving to the head. I'm going to inspect and palpate for any abnormalities of the head. While I'm doing each assessment, I'm also assessing the integumentary system. I will be looking for color, temperature, moisture, edema, any open wounds, drains, any IV sites, or invasive lines that may need assessment. So anytime I'm going through a system, I'm also looking for that. Same with the pulse. I'll always be assessing the rhythm and the depth and respirations as well. So I'm also inspecting the face for symmetry, for the eyes and the mouth in particular. His eyelids are symmetric, and his eyelashes are intact, so everything looks good there. I'm going to assess any visual deficits. Do you wear glasses or any assistive devices? Do you have any trouble seeing?
No.
Okay. Do you have any trouble hearing or wear any assistive devices?
No.
Great. All right. I am now going to assess cranial nerves 3, 4, and 6 for the extraocular movements. And I'm going to do that using the STAR method. So if you could, please follow my pen. And we're going to go in. Great. Everything looks normal there. I am also going to assess pupillary response. So I'm going to dim the lights. And using my pen light, I'm going to shine it in his eyes. Great. So his pupil response was brisk. His eyes are clear. His pupils are also equal, round, reactive to light, and accommodating. Everything that we're looking for. So now I'm going to assess cranial nerves 9 and 10. That is the glossopharyngeal. We're looking for symmetrical palate rising. And it'll also be the gag reflex, for which we're sparing you today. I'm doing that. But so I'm going to have you open your mouth, say ah. All right. And I'm also inspecting the oral mucosa for any lesions. The oral mucosa is moist and pink, what we're looking for. Teeth are intact, and the tongue is lying in the midline of the mouth. I'm going to next test the cranial nerve 11. We're going to do a shoulder shrug. Right. And also face. Okay. And before I move on to the upper extremities, I would lay him in a 45-degree angle, checking for jugular vein distension. I would also palpate the carotid arteries one at a time. And then I would auscultate the carotid arteries, listening for any bruits or swishing sounds, any adventitious sounds using my bell. Here and here. All right. So next, we're going to move on to the upper extremities. I'm going to start at the most distal point. So again, I'm inspecting the skin for color, temperature, moisture, edema. I'm going to take a look at his capillary refill. Should be less than 2 seconds or less. And that looks just fine. I'm also going to palpate his radial pulses. Good. The rhythm is regular. Again, we have a 2+ for him. While we're here, we're going to do some sensation testing. So if you could close your eyes and just tell me where you feel my hands.
Outside my forearms. Outside my bicep.
Great. We're also going to do some strength testing. So if you could hold your arms out in front of you and push up against my hands. Great. And down. Great. And we'll do some range of motion as well. So if you could raise your shoulders. Flex your elbows. And roll your wrist. Make a fist. Very good. All right. And I'm going to do grip strength on you. So if you will squeeze my hands. Very good. So range of motion, everything was symmetric. Grip strength also symmetrically strong on each side, which is exactly what we're looking for. I'm going to move on to the chest. So I am inspecting and palpating for rhythm, rate, and depth of the PMI, which is found the 5th intercostal space at the left midclavicular line here, and that is normal. I'm also observing the rate, rhythm, and depth of the respirations, and again the rate is 12 to 20. So after I have palpated and inspected, I'm going to auscultate his lung sounds. I'm going to use a diaphragm, a stethoscope, and I'm going to be listening here. So that's the right upper lobe, left upper lobe, right middle, and we're going to go right lower, and then left lower, and raise your arm. Great. Additionally, I'm going to go to the back. So if you would just kind of swing your legs around, I want to be able to show them what we're doing. So I'm going to go here, 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 and here. Everything looks normal there. So I would just document if I heard any crackles, rhonchi, stridor, any adventitious sounds like that during the auscultation. Next, I'm going to auscultate his heart sounds. I'm listening for any murmurs, extra heart sounds, S3, S4. So also doing this with the diaphragm. I am doing the aortic valve, so S2 should be greater than S1. Pulmonic, S2 should be greater than S1. We have Earth point, S2 and S1 are equal. The tricuspid, S1 should be greater than S2, and the mitral, S1 should be greater than S2. So that completes the chest. I'm going to be moving on to the abdomen. First, I'm going to ask if you are experiencing any urinary retention or a loss of control, any bowel like constipation or incontinence there. Great. When was your last bowel movement? Wonderful. So I would document those things. I'm also inspecting the abdomen, looking for no distension. A soft, slightly rounded abdomen is normal. I'm first going to auscultate all 4 quadrants. I would listen for a whole minute in each quadrant. So I'm going to go right, lower, right upper, here, more like here and here. Looking for 5 to 30 vowel sounds. Anything less than 5 is hypoactive, greater than 30 is hyperactive. If I suspected I heard 0 vowel sounds, I'm going to listen to each quadrant again for a minimum of 3 minutes, up to 5 in each, and then document the findings there. Next, I'm going to palpate. Let me know if you feel any tenderness anywhere. Everything looks good there. And lastly, I would palpate his femoral arteries. So moving on to the lower extremities, I'm just going to tilt the camera a little bit so that we can see his feet. Obviously not a videographer. Okay, here we go. It's probably super loud. Sorry about that. All right. So I am inspecting, again, for color, temperature, moisture, any edema in the feet or the legs. I would perform the capillary refill. Since he took off his shoes, we'll go ahead and do it. Okay. I'm going to palpate his pedal pulses. Okay, they're even, 2+, regular rhythm. I'm also going to palpate the posterior tibialis, which is in the inside behind the ankle. Those are also regular and even. So I'm going to do some sensation testing while I'm here. If you could close your eyes and let me know where you feel.
Outside of the calves. Outside of the thighs.
Great. So I'm going to adjust the camera one more time. Okay, and if you could stand up for me, I'm going to do range of motion for the legs. So if you could lift up your leg, whoa, twist your ankle, point your toe up and down. Okay. Bend your knee. Rotate the ankle, toes up and down. Okay, great. You can have a seat. Lastly, I'm going to evaluate his fall risk using the Braden scale. So the maximum is 23. Anything 18 and below, he would be at risk for falls. And that completes my head-to-toe assessment. Thank you.